The prescribing course is a tedious 4 to 6 months program you do in a university, either online or face to face, in addition to your full-time job. So it's something you want to plan very well before you go into it. It's something you can do. I mean, if you've done 4 years in the university for your pharmacy undergraduate, prescribing course is something you can actually do. It's just about planning and getting yourself mentally ready for it. So applying to the university is one of the crucial steps in doing the IP course, because you will need to, university applications most times it's not very straightforward. Some universities are easier than others to apply, but some basic things will stand out, like you need to give your scope of practice. So for you to even think of IP course, you should have thought of a suitable scope of practice you want to specialize in. It can be diabetes, it can be hypertension, it can be minor ailments. So you must have picked out one scope of practice that you want to do. But most times the university will want you to kind of defend or tell them why you've picked this scope of practice, what you're going to achieve when you are done with the prescribing course, how you're going to use it to help the community, for instance. So you should be able to defend your choice with the university. Mostly in your statement of purpose, you tell them your journey, your career journey, and why you pick this scope of practice and how you're going to use it to help the public or patients when you are done. Another thing that you also need to prepare is your learning needs assessment. So learning needs, I don't know if it's all the university that does that, but most of the university, they will need you to prepare your learning needs assessment along with your scope of practice. So this learning needs assessment is things that you will need to kind of learn while on the course, things you don't know about that topic that you want to develop, like areas that needs development. So for me, it was a bit hard because I was like, why should I be doing this when I've not started the course? But it's something you need to sit down with your DPP. You draft, you factor it, and depending on your knowledge and your experience, you will know where you will need to develop more while doing the course. So that is what the learning needs assessment is. For instance, if you are doing hypertension as your scope of practice, you might want to state that your learning needs could be how to check and interpret blood pressures, other tests that you need to do for hypertensive patients, and how to apply those results to your disease management. So things like that, depending on your scope of practice. So you need to be aware of that and plan that ahead.